Good afternoon and welcome to your weekly medical town hall. For those that are tuning in for the very first time, I am Gwendolyn Foster, your medical group commander, and with me is Captain Lankert, our public health officer, Captain Gordon, our psychiatrist, Ms. Johnson, our family advocacy coordinator, and my right-hand woman, Chief Bradley. So as we are giving you your information for this week, please don't hesitate to use that number that is flashing across your screen to send us your questions so we can answer it for you. And with that, we'll turn it over to Captain Lankert for the current situation. Captain Lankert?
Awesome. Slides, please. Okay, so this is going to be the site picture for COVID-19 across the U.S. and California. It's a little bit different than what you've seen in the past, mainly the top left data set, essentially. And so what you're looking at there is the darker the bar, essentially, the more cases, or on the right side, the more deaths. So this is just to highlight that though California is in the top 10, when you adjust for population, which is that per 1,000 people column you see, they actually are much lower than a lot of the other states in this top 10. They actually drop down to number 9 out of the top 10. So population size does matter when we're looking into how many COVID cases, where are they at, what's that actually mean for the community. As well as that, their testing really does impact. So if a state is testing more, you're going to see more cases, and that's why you'll see some discrepancies amongst testing, amongst data reporting, all that good stuff. But right now, basically, the message is that COVID is still everywhere, as you can see in the bottom left-hand U.S. spread map. And it's not really quite going anywhere at this time, especially in our local community where we still have cases increasing. And just to highlight the point that case counts are going to be underestimated, since as we know, COVID can range from anywhere from being asymptomatic to really, really sick to just having a cough. So not everybody's getting captured by getting tested in the first place. So this is always going to be most likely an underestimation of the true disease burden. And then just one last thing to highlight is that the COVID-19 symptoms have been updated by the CDC in that right-hand box in the bottom right-hand corner. They actually contain more symptoms than was previously reported. So it's going to have repeated shaking, headache, sore throat, new loss of taste or smell, and muscle pain. If you have 2 of those, it actually means that you may or may not have COVID. And as always, please contact your medical provider if there ever is a COVID concern. Next slide for the local picture. So this is, again, these are pretty much your normal slides that you'll see every week here, and the reason why I want to highlight these as well is it does show population density, what I was mentioning from that last slide with those the 2 lines that are on that top left-hand corner graph. Some of the reason why you see such a sharp increase around that time period where you see Palmdale's numbers go up so high is because the testing criteria actually changed, which is what's highlighted on the top right corner, where now California is actually reporting every single test performed rather than people it performed on. So some people were tested multiple times because of whatever their symptoms are and all that good stuff. And then the bottom left-hand corner, it shows that we're still seeing increasing cases for our 7-day running average outside of our gates. So COVID's still here. It's not really going anywhere, and cases are still increasing. Last time there was a question about, is Edwards in line with what the local community is doing? And the bottom right-hand quadrant is actually trying to highlight this, that we are in line. Kern County and Los Angeles County are both basically doing the same things as far as social distancing, stay at home, all that stuff. And Edwards Air Force Base is following pretty much in lockstep with what the local community is doing.
Thank you, Captain Lankert. Next slide. And again, this is just showing our current services that we are providing. Even in degraded services, with us being HPCon Charlie, all our doors are open for you. So please continue to call our appointment line for whatever service you may need, so that way, whether it's virtual or face-to-face, that we provide that service to you. We also continue to work very closely with our community healthcare partners, making sure whatever needs that you have off base are being met. And in that close communication, they continue to let me know that their doors also remain open, and they have the bed available that is needed to be able to provide for our community, as well as currently right now they have very low COVID patient numbers, but they still remain very postured to surge if that became a necessity. Next slide. And as you heard me say that with us being an HPCon Charlie, I know we get questions as far as when are we going to see more services available? What are we looking at? What will be those triggers? So again, you've heard me say in previous town halls that this is a whole of government, whole of nation approach. So we continue to watch those same triggers that our state and federal government is looking at. So as far as that decrease in consistency, as far as symptoms are a decreasing number of cases, as well as making sure that our local community partners are able to take care of our COVID patients if needed, as well as to make sure that that robust testing is available. And this slide, we're going to make sure that is posted on our Facebook page as well. Next slide. And I want to share with you, I know we get a lot of questions about testing, and then in-house capabilities, as well as that antibody testing. So we have created a quick testing reference guide that we're going to paste on our Facebook page as well. And this is just a guide to help you to know what you need to do as far as what testing is available right outside the gate. With all the testing that is out there, they all require some type of evaluation or appointment. So again, we can't foot stomp enough. Make sure you call your healthcare provider, and if that's us, you call the appointment line, or if it's after hours, you can call the nurse advice line. So that way we can make sure you get to where it is needed if that testing is required. Next slide. And as you heard me talk about as far as more services, we have turned back on our TRICARE online patient portal. So if you are trying to make a regular appointment, you can actually go on to TRICAREonline.com to make that appointment. But if you have or think you may have been exposed to COVID, that we still need you to use our appointment line to give us a call, so that way we can make sure you get the care that you needed for that. And next slide. And with that, I'm going to turn it over to our mental health folks, and they're going to talk to you a little bit about maintaining that resiliency. Captain Gordon.
Hello, everyone. Thank you so much for taking the time to tune in today. I'm Captain Gordon, one of the mental health providers here at the 412th Medical Group. It's an honor and privilege to be here with you today as we are all experiencing this virus together and learning different ways on a day-to-day basis with the change in information that happened so suddenly. How do we cope with this? So I hope that you all will right now take time to kind of listen to kind of what we're presenting. Socrates once said that the perfect human being is all human beings put together. We are working as a collective, as a one. And I think there is strength in numbers when it comes to battling anything in our life. And we've all come here together, taking time out of our schedule to make sure that we offer these tips so that as you cope with this virus or any other issues that you may have going on right now, that you do it productively and healthily, and it won't lead into anything that will become unmanageable. So with that, just give us a few moments of your time and take a few notes as to what we're about to prepare to present to you. If we can pop the slide up here, I'd like to take a moment to kind of go over this slide that we presented last week. This slide is a very important slide. It has a lot of useful information on it. This information is not going to harm you to try. Do not be scared to try some of these things. Let this virus be something in this experience that we are all having. Write your legacy. Give you something to work towards. That way, when you are reflecting back on this one day, you're going to see how you persevered through this, utilizing the skill set that maybe we have shared with you today. And with that, that means taking care of yourself, making sure that you're exercising, making sure that you're eating healthy. You know, we are what we eat, but we also are what we think. So make sure that you're maintaining a positive mindset, eating healthy, and exercising. Now, I'm not asking everyone to get out and run 45 miles in 1 week, and that's what I've been averaging, honestly, to stay fit and to be healthy mentally and physically. This is not a time to run around in circles and scream, what do I do, what do I do, what do I do? This is a time to actually work on yourself. Work on maybe some issues or some projects that you've kind of neglected because of the nature of the mission sometimes gets in the way. But this is a time, once again, to redefine yourself. With that, to pursue some goals, educational goals, financial goals. Make sure that you're not on Amazon running up your credit cards during this time. And, you know, I find myself loving to shop as well, but we have to maintain that discipline and make sure that you act accordingly and don't be irresponsible during this time, because you know what's going to happen. What you do today, you're going to pay for it tomorrow. And so I want to make sure that you don't lead off and do something like that. And also look at your own profession. Some of you may be thinking about getting out of the military. Some of you may be thinking about going back to school. You know, schools are realigning right now in a way that has never been realigned before, and that is doing a lot of the classes that you used to have to go to a campus before. They are now offering that online. So if you want to start studying, I say use this time wisely to better yourself. Don't sit around and idle. My grandmother once used to say that an idle mind and an idle hand is the devil's playhouse. And we're going to be talking a little bit about that in the next couple of slides coming up. But you'll see what I mean, how you can kind of get in these mind traps during a time of idle time. So keep busy. Invest in your personal life. Invest in your family. And maintain a routine. Every morning I get up at the same time as I would going to our clinic. And it's very important that you maintain some sort of ritual, some sort of routine, because that way you don't add in any of those things that could potentially get in the way of you doing your job at home. Because many of you are now doing three things. You're an airman, you're working from home, you're a parent, and you're a teacher. So you have to find that balance and stick to a structured schedule. Another thing that I'd like for people to do is maintain those positive connections. Just because you're having to physically distance yourself from people, make sure that you stay connected to relatives, family, and friends across the world. You know, technology, you can't use technology as an excuse anymore or blame it on the post office that they didn't receive your letter and then you hadn't received anything in the mail. You have to stay connected too. The phone works both ways. And so if you want to remain isolated, that's unhealthy. But continue to be that outreach to people. Check in with each other. Check in with your family and friends. And offer some sort of support that they may need. And then think positively. And I'm not saying and silver lining things and trying to be Disney here, but I want you to, at least if you start falling into those mind traps and you're having that stinking thinking and that negative cycle and that record that keeps on playing, what works for me when I get into that, and we're all human, folks, I'm sorry to tell you there's no perfect person on this base or anywhere else, so we're all going to have the ups and downs. Make a gratitude list. Be thankful for what you do have. When I go to the commissary, I make sure I tell the cashiers and the folks who are stocking the shelves that I'm grateful they're there. There's chaos around the United States. And so with that, I find peace in understanding and trying to focus on what I do have versus what I don't have, and what I can do versus what I can't do. And so I know I'm talking fast here, but I do have a compassion about this. And I want people to know that just because we're going through this, it's not the end. You're going to continue to find ways to cope with this. And also accept what's going on. Don't sit here and try to find it. Don't fight it. Don't try to oar up a steady stream using a toothpick and a canoe. You're never going to make it. So you have to think positive, and you have to maintain and accept things that you normally can do. And stay within that. Don't overwhelm yourself. Make sure you also utilize resources. Don't forget about the disaster mental health resources. That's 4 undocumented sessions that the mental health clinic offers. And if you're interested in that, call our clinic at 277-5291. And I promise you, we can connect you with the right person if you're having a hard time coping with this. This is open to active duty, dependents, as well as civilian employees if you're having a difficult time. It's 4 undocumented sessions. Now, on that, we have to make sure that we assess for safety. And so if there are any safety concerns, then we have to take it to a different level. But we do have protocols in place if that happens. Okay, so I want to talk to everyone about something uncomfortable. And what I was mentioning earlier is the devil's playhouse in idle time. And folks falling into these traps trying to cope with whatever you have going on using a substance called alcohol. So if we can bring up this slide. Responsible drinking during a time of a pandemic. This is very important, and some of you may be shocked about these stats, but they're real. And when you don't occupy yourself and your time with things that are productive, you're going to fall into things that can be pretty detrimental to your career, to your marriage, to your own well-being and your health. So take part and take some notes here and take this seriously. Like the wing commander always tells us, we have to be ready to fight tonight. We have to be ready for anything. And if you're getting pie-faced every night, how productive are you going to be if we're recalled? How useful are you going to be if you are trying to come off of a bender and fighting a hangover. You're not going to be in that mindset that we need you to be in. I'm not saying don't drink. I'm saying drink responsibly. And if we can bring that slide back up, and what that looks like so far is what the 2015 through 2020 guidelines say. And it's 1 drink per day for women and 2 drinks per day for men. And you'd be like saying, oh my gosh, that's terrible. But there's a reason for these guidelines. And if we can see the next slide, it'll kind of reiterate and drive home some of these stats. So some of the things that people have a tendency of doing when they have the idle time is binge drinking. And that is a very dangerous pattern of drinking. Mostly happens a lot on the weekends where people just down alcohol in a short amount of time to get where they need to be. The problem with that is it's unhealthy, and it can lead to an increase in tolerance and then an alcohol problem later on. So I want people to be mindful of the intake that you are consuming on a weekend or whenever you do have a chance to partake in a beverage. And so heavy alcohol use is considered to be, for men, 4 drinks per day, and then 3 for women. Things to consider, and there's a misnomer out there, and there's a rumor that, hey, I can't sleep, I'm going to use alcohol to cope with this. I'm here to tell you that you're not going to get a good night's sleep with alcohol in your system. It's going to cause you not to get into that restful state of sleep called REM sleep. That's an important stage that will allow you to feel well rested and wake up in the morning refreshed. It's actually going to agitate that, and you're not going to be able to sleep productively. And then also make sure if you do decide to drink, and drink responsibly, make sure that you have a plan, that you stay hydrated, that you do have food on board, and make sure that you have someone there holding you accountable. Don't be drinking alone, and then that way hopefully it won't lead off into any other issues that you may have into this. And I'm just being real with folks. This is a time when there's not a lot of oversight. There's not a lot of people in your life. So you need to make sure if you don't have someone policing you, try to be responsible, try to police yourselves. But if you're having issues with that and you really need someone to talk to, please call our clinic at 277-5291, and we can patch you through to someone who can kind of help you regulate some of those things that you might need some help with. Hey, we're human. We have a lot going on. We can only handle so much, right? It's just a matter of reaching out when we do have difficulties. So I'll quit preaching now, and I believe we're going to move on to the next slide for Arlene.
For additional helpful resources, there is a list of different helping agencies that you can see on the slide. This slide will be offered or available on the Med Group Facebook page. And so not to worry, not to feel rushed to jot these numbers down. You will have access to it. Next slide. And again, as mentioned last week, these are additional supports, parenting classes, some smartphone apps that can provide additional support on how to strengthen your relationship, parenting skills, parenting classes, and also how to deal with anger and stress, learn mindfulness techniques, and moving forward, how to deal with stress and how to overcome those difficult times in our life. And then, of course, if you're interested in additional resources, don't hesitate to give Family Advocacy a call, which is at the number area code 661-277-5292. Now, I would like to talk to you kind of like a heart-to-heart of being, being a parent, having to telework, also being an active duty member, and any other additional roles that you're trying to balance. It can be quite challenging, and I speak this, I can completely relate as a mother of 3 in the home. So some guidance or some tips on how to have this as smooth as possible and making sure you have that balance. So one is to maintain a routine. It's so important to maintain that routine, continue to get up in the morning, have the children have their regular bedtime routine and get up in the morning as if they're going to attend regular school. Have an area in the home that's designated for schooling so they know when they're in that spot, they have their snack and they're in the mindset of that they're going to be doing some schoolwork. And these are things that we can apply for ourselves as well, right? Because I know it's easily to get sidetracked when you're working from home. So, and to be empathize. Kids are going along with us in this difficult time and trying to make adjustments. So you might see that your little ones, as well as teenagers, might be having a difficult time. Maybe they're a little more emotional, right? Maybe they're expressing anger. Maybe they're wanting to sleep more. This is normal. So what I ask of you is just to sit back and ask you this question of Holt. Are they hungry? Are they feeling angry? Are they feeling lonely? And are they feeling tired? Once you address those four, it might fall under the umbrella of the COVID-19 having the stay-at-home orders. So listen, have that talk. Share your experience of what you're going through. Yeah, this is really frustrating. Yeah, I'm feeling overwhelmed, or I understand I'm getting a little buggy staying in the home all the time. Let's go outside and go for a drive. Understand that school is not only a place for academics, it's the social part as well. And so they are missing their friends and their teachers. So reach out to their peers and have that connection. Monitor how much time individuals are gaming in the house. I know this is an issue in my home. And I know it's a way to keep them busy, but there's other activities that they could be doing outside. Again, having this to stay at home does not mean you have to be cooped up in your room. And so it's important to get out there and be active as well. And to also be extremely mindful of those who unfortunately, this is a big year for seniors graduating. They're missing out. They're going to be missing out on their prom and other activities that are leading up to the graduation. Try to stress to them that this does not take away how special this time of the year is for them, and what a great accomplishment it is to graduate. And talk to them about how can we make this a special time, so that way they know that they're not forgotten. We're still celebrating, and they're still remembered in this special time of their life. This is huge. And so, again, having that connection with your kids, talking to them, maintaining a routine, and understand that you might be adjusting well to this transition, but the little ones might not be. And so if you need further guidance, there's going to be a link that's provided on the Facebook page that I believe it's the homeschooling through Med Group 37.
That's correct.
And so it can offer additional guidance on how to have this be a smooth time in the home and for homeschooling. So if you have any questions, any concerns, our services are still available. Again, I'm Arlene Johnson, social worker with Family Advocacy, and you can reach us at 277-5292. Thank you.
Thank you. Thank you, Captain Gordon and Ms. Johnson. Next slide. All right, before we turn it over to answering your questions, again, we are all in this together to flatten that curve. As you heard me say earlier, now you can use the TRICARE online portal for regular appointments, but again, please use our appointment line number or the NOW if you think you have or may have been exposed to COVID-19. Again, we need each other to be able to flatten that curve along with our community partners. And I want to share with you that all of us are in this together. Right now, there are over 100,000 military personnel. That's Army, soldiers, airmen, and Marines, active duty, Guard, and Reserve, that are combating this COVID-19. And that's including over 4,000 medical personnel right now working to combat this. And I know that we will defeat this adversary. So with that, I just want to say thank you for tuning in. And Chief, I'm going to turn it over to you for any questions that we may have received.
Thank you, ma'am. All right, we'll start with the questions we received on Facebook earlier in the week. The first is, during this time, can dependents still be seen to receive a referral? This one in particular, my child needs to see an ENT and psychiatrist. And the answer to that is yes. Please contact the appointment line to first set up that virtual appointment like we mentioned. Once that happens, if the provider determines that they need to see your child in-house, we will set up a physical appointment. But that physical appointment may not even be necessary, and they may be able to process that referral just through the virtual. But referrals are absolutely still happening. You can also make that appointment through the TRICARE online option, like Colonel Foster mentioned. All right, some questions. We did talk a little bit about this, but we can kind of add in. What are the determining factors that would lead us to go to Delta? And then what needs to happen for HPCon to improve and go back to Bravo? And really what we're doing right now is, because the situation changes so fast, we have some states that have opened up, so we are looking heavily at those now to see if there are spikes. For us locally, our community determines that. Of course, Colonel Heiger will make that decision with advice from our public health office and public health emergency officer, along with mission needs. So a dramatic spike would really be needed for Delta, something very dramatic. For us to go back down to Bravo, we need to maintain a very stable situation. But any information on specifically on those HPCon levels, we recommend you tune in to Colonel Heiger's town hall on Fridays at 1. All right, antibody testing. We are getting quite a few questions about antibody testing. Right now, we do not have that capability in our local lab. We do have 2 reference labs. One has very recently obtained it, but we're still working through the wickets of actually being able to use that. The other, of course, is looking to get that. As we go forward with different requirements and guidance from the CDC, we will look to add in those possibilities. But as mentioned earlier, any antibody testing really needs to be recommended by your doctor for that to be covered by TRICARE. If you were to try to go get it on your own, you could be coming out of pocket for that without a medical necessity from your provider. All right, and the next question, is there an issue getting medical stores via logistics? I've heard people have been waiting weeks for treatment because items needed are not available. We're not tracking this currently in any situation for our routine treatment in-house. I can't speak for off-base network if for some reason they don't have something that they need, but routine treatment is not being withheld due to medical supplies. We currently have an adequate amount of supplies to operate normally with a stockpile to use for any reason if our initial supply is to run out. So that's good news for us, and we are seeing patients as usual. So we'll turn to see if we've got any more questions. Let's see, and we've got a question. Is there an easy one-stop process in place for those retiring or PCSing to obtain dental and medical requirements?
We are currently working on a one-stop process, a virtual process for our out processing needs for the installation. So that should be coming out shortly, because we do know even with the stop movement, there are some that are missing essential, and they do need to be out process to be able to make their PCS move, as well as we know that separations and retirements continue to occur. So that will be coming out, and once we have that in place, we'll definitely make sure that it is on our Med Group Facebook page.
I will add that you do start your separation physical process through the appointment line. You can call them at, let me make sure I got this right, 661-277-7118. Tell them your situation. Hey, I'm out processing. I need to get my initial separation physical or a SHIPI. And they will get you scheduled with our BOMC clinic, likely a virtual appointment to get that process started. All right. We don't have any extra questions yet, but I would like to tell everybody, for those who just tuned in, who we have here on our town hall for you to address any questions to. We have Captain Gordon from our mental health clinic. We have Arlene Johnson from our Family Advocacy Clinic. And we have Captain Aaron Lankard from our Public Health Office. And we have Colonel Gwendolyn Foster from our Med Group Commander. So please ask those questions. I know they had lots of good tips today on relieving stress and what to do to help you turn to some more productive ways to use your time.
Make a distinction that way folks don't get confused with coming to the mental health clinic, especially mentioning the disaster mental health services that are for undocumented sessions. I just want to reiterate that that's not therapy, it's support. If you have a greater issue, then definitely we can help you navigate through getting referrals if you need that. However, I just wanted to make that distinction that disaster mental health is in place to offer that comfort and support during the time that we are in, but it is not therapy.
Thank you, sir. All right. There is a question. Why are people advised as masses to overreact by staying home and shutting down businesses? Shouldn't just the people who are at risk and unhealthy stayed home? Just very concerned about loss of liberty.
Captain Lankard.
Okay, well that's a very complex question. So the reason why is right now, since COVID is so prevalent, the only way to really, everybody's at risk at this point, essentially. So everybody across the nation is at risk. There's some people that are going to be at risk for greater consequences, which is going to be the death, the severe mortality, morbidity, all of that, which we already know is in those high-risk populations of people with pre-existing health conditions and other things like that. However, everybody in the United States right now is considered a vector for this disease until proven otherwise, which means whether you're at risk or not, you can still transmit that to somebody else. And so the only way to honestly get ahead of this disease, now that it's actually established itself and we have community transmission, is to do the social distancing. The mask wear is helpful, PPE is definitely helpful. However, the only way to prevent these infections is to prevent people from coming in contact with each other, or at least encouraging, hey, if you are going to, keep that 6 feet, keep very separated, because the only way to truly prevent infections is to not present that opportunity for an infection to spread. So I understand, and we all are very, very, I guess, considerate of the fact that a lot of people's, what they feel that their liberties are basically being infringed upon, or that I really want to go out, I want to do this or that, which a lot of times you can still do the normal activities just with some considerations, mainly being stay away from people and also wear that mask. The reason why it happens at such a grand scale, and believe me, I want to go out still, I want to go do some stuff that I'm used to going to do, I want to go to the mall, I want to do all this stuff too. All of us here are impacted by this, and we're all kind of going through the same things. However, the only way to prevent it from transitioning more across the United States, across our local community, and therefore overwhelming the healthcare system is by flattening that curve. And the primary way to do that is to put restrictions on, all right, well, we're not going to have these mass gathering places. We're not going to have mass sporting events, those types of things. We're going to encourage people to stay at home. On the one hand, it's good because it encourages innovation for people to reach out and do the same things that mental health was just talking about, as far as connecting to people, learning new ways to work, and kind of navigate life under that. But believe me that nobody here wants it to go on for a day longer than it absolutely has to. That's at every level of government. That's a CDC, that's a World Health Organization, that's our office here on Edwards Air Force Base. I know for a fact nobody at the leadership level on Edwards as well wants it to go on one day longer than it absolutely has to. So the only way to make sure that the curve is flattened currently due to that community transmission is to make sure there are some limitations on gathering and situations where that community spread might happen. In an ideal world, everybody would do exactly what they're supposed to do. They're supposed to wear whatever PPE they're supposed to do. They're supposed to keep that 6 foot distance and it'd all be great. However, that's not necessarily the case. So there will be people that don't necessarily adhere to some of the guidelines that would maybe open up places faster, which is why these guidelines have to be put in place in the first place, and why you see as a nation we've kind of really, really harped on that social distancing. The governor has also, and the base commander has also said, like, no gatherings of this size, nothing like that, because that's really the only way we can prevent everybody who right now is considered at risk from transmitting these diseases and then impacting other people and then increasing deaths, increasing the burden on the healthcare facility. And we all know kind of what happened in Italy with them having to make day-to-day decisions over who's getting a ventilator, who's going to literally live or die that day. Right now, social distancing is in place so we don't get to that point. So it's definitely inconveniencing. Like I said, we're all going through it. We're all feeling the pains and the cabin fever, and all those emotions as well. But it's literally at this point for the greater good to make sure we do not escalate to that point, essentially. And it's been working, because off base right now, the hospitalizations due to COVID have been staying relatively stable. So that's the sign that that curve is flattening, and that we're probably, hopefully, as long as we keep doing what we're doing, and then gracefully reopen, one would say, as long as we follow those lines and are very considerate about it, we could prevent us from going even further down that road to having even more cases, even more deaths, which right now we have over 50,000 deaths, and that's what we're trying to tailor off and prevent. And that's through the social distancing, as inconvenient as it definitely is.
Thank you, ma'am. We have one question that really might be more for Colonel Heiger's town hall tomorrow, but I think we can address from a medical perspective. What needs to happen to get people back to work?
All right, I can take that one. So some things that need to happen to get people back to work. Again, it's just what I said. As far as I believe the wing is on the same level. It kind of goes to what Colonel Foster was saying, as far as going back down to HPCon Bravo, kind of going back to what we see as normal, and re-upping those things. So to get people back to work, it's almost like a multifaceted approach, in the sense of, if they're going to go back in the workplace, is that workplace safe? Is that workplace able to be adjusted so that disease transmission is at an absolute minimum, which we've seen that with a lot of mission essential people being able to work at their workplaces now, but in consultation with both bio and us, and saying, all right, well, make sure you wipe this down, make sure you make social distancing, make sure you're wearing your PPE, so your mask. So in order to really get people, Edwards is its own kind of thing as far as getting people back to work there, but as a greater countrywide effort, a lot of it's going to be, where do we open up first? How can we open up to prevent disease transmission in a healthy and helpful way? And then also, what else is happening around us as a nation? Are we seeing those spikes? Are we doing it slowly, in the sense of, like, okay, now these places can open up under these conditions because we have the 6-foot distancing rule, we have all of that. So it's definitely a thing that can happen in the very near future. It's probably not going to be all at one time. I know some states are trying to do kind of like an all at one time thing, but the thing we're worried about, especially at Edwards and especially around us, is that if you do something that's like, all right, now all the businesses are open, that might cause more spikes in cases and might cause this thing to actually be prolonged. So again, they're going to be looking at it from the perspective of, what should we open? What can we do with additional PPE, with doing additional measures? And then what else can we add in as we watch the cases, as we watch to see kind of how the disease ecology kind of reacts to what we're doing, essentially.
Thank you, Captain Lankert. And just to pile on that, everything that Captain Lankert is saying, that same information is getting to our base commander, Colonel Heiger. So he's looking across the installation, looking across with our community partners to make sure we have all those mitigating factors in place, to make sure that when we do start coming out of idle, throttling out of idle, that we have everything in place to keep you safe here at Edwards.
All right, Colonel Foster, I have a question for you. After health protections relax and we can resume somewhat normal operations or regular operations, how will medical screening appointments be conducted? For example, I am active duty and may have IMR appointments that I need to take care of, but there will be a backlog of personnel, military and non, all in the same boat.
That is a good question, and we're actually working on that right now. So we continue to reassess all the services that we're providing, keeping an eye on those backlogs. So for some things, we don't even have a backlog, because we are working on those behind the scenes and seeing what we can do virtually, what we would normally have done face to face. So we continue to do that. And as we do increase our services as we come out of HBCon Charlie, some of the services that we're providing may stay virtual to be able to get you in sooner, as opposed to those face-to-face appointments. We're also starting with virtual telehealth, using some of those applications that we haven't been able to use before, like Google Hangouts, Skype. Also, there's something Duo. So we're looking all at ways that we can actually connect with you for your appointments, for whatever that need may be. So that way we keep that backlog to a minimum. So when we do come completely out, it is not causing us 90 days, 6 months to get us back to where we need to be.
I'm going to add a little pitch to that. If you have been the patient for one of our virtual appointments and you like that service, please share that. Share that with your provider, share that with our medical group so that we can help retain that service once we do go back to normal operations. So far, we're hearing good things about our virtual appointments. Okay, I have a question, Captain Linkard. I know the short answer to this, but I think there is a public health piece to it. If a non-active duty person was to travel by car to another state for a few days for a family-related incident, would that person still need to self-quarantine upon returning to California? Short answer currently is yes, but there are some things to know about self-quarantine that maybe it's not as bad as it sounds. Captain Linkard.
Yeah, so that's absolutely the correct answer. So per base policy right now, if you go outside of the local area, there is that 14-day quarantine. Now, if it's just because it's travel related, you're still able to go out for necessities. You don't necessarily have to lock yourself in your home. You don't have to separate yourself in a room, separate from your family, like we would encourage for isolation if you were actually like sick. So if you were under a travel related restriction of movement, which is what's being described, you can still go outside. You can still do activities you want to do. You can still go running and stuff. It's just the point is to keep you kind of away from the main base population, so that if you do end up getting sick because of wherever you were at, whatever location you went to, that way you would be separated away from the main population. However, like I just mentioned, you can still do most things that you'd want to do. It's just staying away from community congregation areas such as the commissary, unless necessary, and places like that, essentially.
Thank you, ma'am. And if you do have to go out for a necessity, you got to make sure you're masked up and still practicing those physical distancing guidelines that we push out. Okay, let's see if we've got another question here. And right now, I think we're in a little bit of a lull. If you have any other questions, please get them in quickly. We're coming up on our hour point, so we'll probably close out relatively soon. Does anybody have something that they would like to readdress, maybe before Colonel Foster provides her closing remarks?
I can say something real quick. I think that a lot of people get the cabin fever and they're not seeing options past the door of their own house. I will tell you that the desert, yes, it's hot here. Yes, it's pretty windy today, but get outside. In my neighborhood here on base, I see kids out playing with their parents. They do wear masks, but at least they are out of the four walls. They're off the games. They've turned the TV off. They've turned the news off. They're actually out trying to get some sunshine. You know, sunshine, all we hear is like, wear your skin protection, but it's really good for the mood too. Vitamin D, get out there and get some. It's going to be good for you. It's not going to hurt you within reason. I think folks just get so focused on tunnel vision on what they can't do, but focus on what you can do and what you can control. Heck, there's a lot that we can't control right now. But if you rely on others and you talk it out with others and you really embrace yourself around like-minded people that are goal-oriented, you're going to make it through this. And it's not going to be easy. We're all probably going to have some sort of battle scars coming out of this, whether it's mental or physical. But get off the couch. Get outside. Take some walks around the neighborhood. You're not in total lockdown. And I just encourage people to think about some of those things. Focus more on what you can do. Don't focus on what you can't do. There are people who get paid a lot more than I get paid that are making decisions. But you know what? I'm trusting them that they're making the right decisions. Because if you look at New York, that place was really, really bad and continues to be a hot spot. You don't want to end up like that at your doorstep in your neighborhood. So just kind of think about it from a different perspective as to what, be grateful for what we are doing to make sure that our best interests are being protected, and our health and also our families. And don't be hung up on restrictions. And I know that probably people out there saying, hush, stop that. But it's really true. I mean, if you really let go and kind of surrender, you can let this test honestly be your testimony, and there ain't nobody able to take that away from you, right? So I'll quit preaching now.
Thank you, sir. Okay, one question did come in with an earlier question, and I just missed it. What about shot records for the whole family? And I will say that you can get those online right now if you are enrolled in TRICARE Online. So you can access shot records, old lab results, all those things just from your computer. You've just got to set that up. And then also the active duty member is able to pull those up from the My IMR webpage. For any dependents, I believe it's under the age of 15. Once they're that old, then they have to get their own account and retrieve them. Let's see, I think...
And I want Chief on that question as well. If you're having problems with that, don't hesitate to call our appointment line, and they will direct you to our TRICARE operations flight, and they will be able to assist as well.
Thank you, ma'am. Very well said. What will it take to really get our workers who are home now back in the workplace?
Really, again, to reiterate is what is going on in our community, our local community. So looking at that decrease in symptoms, cases, as well as making sure our healthcare system can weather COVID patients and making sure that that robust testing is in place. Those are the triggers that we will continue to monitor. And as we start seeing that downward trend, that flatten the curve, then we will start looking at bringing more individuals back into work. So this is definitely something that is very fluid, and we continue to reassess daily.
Thank you. On that note, that is our last question for the day. Colonel Foster, over to you.
Alrighty, so I just want to say thank you again for tuning in here at TCATITU, the Center of the Aerospace Testing Universe. We are here to support you, and we want to make sure that you continue to have that trusted care always at the right place and right time. So we look forward to you tuning in again next week. Thank you.